our syndrome is van der Waals syndrome by Nicole Gartland and Rayanne Bertagna. Physical characteristics. So, van der Waals syndrome is a rare genetic disorder characterized by various structural deformities of the mouth. Children with van der Waals syndrome typically have a combination of a cleft lip and cleft palate, in addition to a pit or slit on both sides of the lower lip. These slits or depressions are usually the same on both sides of the mouth, although their appearance can range from very wide to barely noticeable. These pits are situated usually on the border between the vermilium and the mucosa. Because these lip slits connect to salivary glands beneath the skin, children with van der Waals syndrome typically appear to be drooling, as saliva will drain through these openings. Associated oral findings can include missing teeth, caused when the teeth do not form properly. Um, the upper and lower second premolars are the most commonly missing teeth. And here's some images of some people with the van der Waals syndrome. So, incidence and heritability. This disorder affects between 1 and 3 children in every 100,000. It is diagnosed in about 1 to 2% of children born with cleft lip and a cleft palate. There's no differences in the incidence among races or gender, and van der Waals syndrome is caused by a variety of mutations on the IRF6 gene on chromosome 1. This gene is involved in the formation of the roof of the mouth and other structures during development. The IRF6 gene is inherited in an autosomal dominant fashion, which means the gene only has to be passed down from one parent for a child to have the disease. If your child has this condition, there is a 50 to 70% chance another family member also has it. There's also a high likelihood, about above 80%, that your child will pass the disease on to his or her children.
Van der Waals syndrome itself does not cause learning problems, although those who have cleft lip palate or both are more likely to have speech and language delay and or mild learning issues. Some children with cleft palate have a condition called velopharyngeal dysfunction, VPD. They may have trouble making the correct speech sounds even after the cleft is repaired. Individuals with cleft lip and or palate have speech problems related to their cleft lip and palate as a result of VP insufficiency, obligatory and compensatory errors. A gap in the lip or roof of the mouth can cause problems with breastfeeding and bottle feeding. This can be treated using special nipples. Individuals with clefts of the secondary palate frequently have dysfunction of the tensor veli palantini, which can cause middle ear effusion and otitis media. However, with van der Waals syndrome, there may be reduced mobility of the lower lip from scarring following lip pit removal. Most children with cleft palate have fluid buildup behind the eardrum, which can make it more difficult to hear. The treatment of clefts in children with van der Waals syndrome is similar to treatment for cleft lip and palate alone. Surgical repairs of the cleft lip is around 3 months of age and the cleft palate around 10 months of age. Lip pits are usually removed at the time of the cleft lip or palate surgery. Cleft lips may be taped soon after birth to help reduce the width of the cleft in preparation for surgery. These surgeries take 2 to 3 hours and the child remains in the hospital 1 to 2 nights. Surgery to repair lip pits is mainly done for cosmetic purposes, but can be required as a result of chronic secretion, inflammation, or infection of the lip pits, depending on the depth. Therapeutic interventions is generally required for cosmetic reasons or when recurrent inflammation is present. A dental surgeon should be aware of this syndrome as it is associated with a variety of other congenital malformations. Orthodontic treatment with braces and alveolar bone grafting to fill the remaining gap in the gum line are usually necessary. The first phase of treatment is usually to widen the upper jaw with an orthodontic appliance when the permanent front teeth have come in at around 7 years of age. The bone grafting surgery is done after the widening is complete, and the final orthodontic treatment is started later after most of the permanent teeth are in. Since ear infections are more common in children with cleft palate, a hearing test is recommended to determine whether ventilating or PE tubes, which reduce the risk of ear infection, should be placed in the ears at the time of the palate surgery. In addition, an eye exam is usually recommended during eye anomalies because eye anomalies are sometimes found in children with cleft lip and palate. And that is our presentation. Thank you for listening.